We've all heard stories about challenges consumers face when shopping for insurance coverage in the healthcare exchanges. To discover what consumers are experiencing firsthand, we went on the healthcare exchange and searched for basic information about health plans. The Partnership to Fight Chronic Disease, a coalition representing more than 100 different healthcare stakeholders, is focused on raising awareness of the human and economic toll of chronic disease and advocating for health reforms that lessen that burden. For all consumers, but particularly for people with chronic diseases, having good healthcare coverage is critically important. There are many questions consumers want to answer. Two basic ones are, can I keep my doctors, and are my medicines covered? To see what a consumer has to do, we searched for health plans available in Maryland on Maryland Health Connection. It wasn't clear whether we could shop for health plans without enrolling. We clicked on Enroll Now to find out. This message seemed to require us to set up an account to shop for plans, but it turns out that is not required. We selected Anne Arundel County and identified ourselves as a 52-year-old person looking for coverage. We just looked for coverage for one person and added an income level of $51,000 a year. At that income level, we didn't qualify for a subsidy and could view the full premium costs of health plans. 49 health plans are available. We narrowed the results by looking at silver plans, since those have been the most popular with consumers. There are 17 silver plans available. There is a notice at the top of the page alerting consumers that the premiums listed are just estimates based on the limited information we provided up front, and that actual premiums may vary. Let's look at the lowest premium silver plan available to see what a consumer needs to do to find out what medicines are covered. Through trial and error, we discovered a link to search prescription medicines under the Details section on this website. Here the plan describes what the consumer will pay for different medicines. The descriptions used detail the medicines as preferred generics, preferred brand, non-preferred brand, and specialty medicines, and assign an out-of-pocket cost for consumers under each. This page also provides a link to search prescription drugs. That link sends us to an external website that opens a 16-page file listing covered medicines. Consumers are told in the document they can use the Find function to search for medicines or look at the therapeutic categories listed. There are no instructions given, however, in how to access the Find function. Although the list shows generic and brand name medicines differently, there's no description of which are considered preferred, non-preferred, or specialty medicines, which were the categories listed in terms of out-of-pocket costs on the plan information. That makes determining out-of-pocket costs for a consumer very difficult. Also, the therapeutic categories are not consumer-friendly. For example, a cancer patient would need to know to look under anti-neoplastic agents to see which medicines are covered. Let's take a look at the other silver plan with the next lowest premium. Again, we needed to look under Details to find a link to covered medicines. On this page, the plan also lists information about the consumer's share of drug expenses in terms of preferred generic, preferred brand, non-preferred brand, and specialty medicines. Clicking on the link to search prescription drugs took us to an external website with an option to download the formulary and includes instructions up front about how to search within that document. Once open, the document describes the different types of medicines: generic, preferred, non-preferred, and specialty, that correspond directly to the out-of-pocket costs for consumers described earlier. That's helpful information to have, and good that it matches with the categories listed in terms of out-of-pocket costs. Within the document, the medicines are again organized by therapeutic categories, using very technical medical terms that are not consumer friendly. For example, not only does the table of contents list antineoplastics for cancer medicines, it then divides them into subcategories, such as neoplastic enzymes and antimetabolites. Similarly, cholesterol-lowering medicines are listed under cardiovascular drugs and antihyperlipidemics. Scrolling through the list, you can see that the medicines are divided into the preferred, non-preferred, and specialty categories. That is very helpful to consumers in estimating their out-of-pocket costs for medicines. But the use of technical therapeutic category names is confusing. Once a consumer finds links to the lists of covered medicines, accessing those lists is not difficult. The terms used in those lists, however, are not consumer friendly and present challenges to consumers trying to discover first if their medicines are covered, and second, at what cost to them.